What I was not prepared for was my husband's illness becoming so primary he couldn't function in other things.
Being the only person making the decisions at that point was overwhelming.
I'm afraid of making mistakes.
What changed? Everything. Everything changed.
Caregivers were like the forgotten people.
I don't think in the past there has been enough attention for the caregiver because it is such an overwhelming role.
An informal caregiver is usually a family member or a close friend or significant other. Really, the caregiver is the primary person who steps up and is willing to take on the responsibility and support and provide assistance to the person who's ill with serious liver disease.
Robin got sick starting in 2009, and we didn't exactly know what was going on with him. And when we did find out that it was liver disease, it was pretty devastating.
The surgeon said after some blood work, he said to my husband, he said, I can't repair your hernia. And my husband said, well, why not? He said, because you'll bleed to death on me. He said, there's something wrong with your liver, not really sure what it is, but your blood work is all over the place here. He said, I think you probably need a liver transplant.
Caregivers are so important because as physicians, of course, we can't be with the patient on a day-to-day basis. We may see a patient once a month or so, and in between that time, someone has to help them manage their disease.
The medical consequences of the disease can really make the person unable to take care of themselves in the home. They may need assistance getting to and from doctor's appointments. They will need assistance sometimes overseeing the medication that they're required to take. Sometimes they may have cognitive impairment or confusion, and so they will need somebody who can help them manage day-to-day life during their illness.
If you are about to commit yourself to this, you have to be all in and be fully committed to it. It will last for many months. It's absolutely necessary, but things will get better.
The research that's been done has really demonstrated that caregivers, in fact, do better in their role, can really be more successful and more competent when they are given more awareness and have greater knowledge of the disease, when they learn strategies or skills for how to manage the multiple aspects of their life, and when they are able to get also support and encouragement for self-care. Because the long haul of providing assistance and support to a friend or family member over the course of a long chronic disease requires that the caregiver take care of themselves as well, both emotionally, physically, and in terms of managing their own day-to-day life.
I told her the other day, I said, I think this has been harder on you, Deb, than me. Because I'm just the one that's sick. She's the one that does all the scheduling and all the pills, she does everything else. I don't know what kind of pills I take. I ask her, she knows. I can't say enough about her. I'm proud of her. It's made us closer the last 6 years.
Caregivers will speak very movingly about the rewards that they get from caregiving. It can be very meaningful for people to care for someone that needs that assistance. So there are some well-being benefits from caregiving. It's just that we always have to be concerned that we advance the fact that caregivers need also to be supported and recognized for the role that they're playing.
I just can't thank her enough. I can't imagine any human doing what she does, or a person having that much love for their spouse as she has.